Hello everyone, welcome to our channel. So I am Dr. Aditya Sai from the Shoulder and Knee Clinic. Today we'll be talking about ACL injuries in the female athlete. So ACL injuries in a female athlete is a very common problem and a lot of times understood incorrectly and a lot of times addressed also incorrectly. One thing which we need to understand is women are more predisposed to ACL injuries compared to men. Now there are a few reasons for that. So if this is your knee joint and the ACL, this area is called the intercondylar notch. So women tend to have a narrower notch compared to men, which predisposes them to a ACL injury. Second reason is in women, the quadriceps tone is higher than the hamstring tone. The function of the ACL is to prevent forward movement of the leg bone or the shin bone on the thigh bone. So it prevents a forward movement of the tibia on the femur. The quadriceps, which actually pulls the tibia forward, is more stronger in women compared to men, which again predisposes them to a ACL injury. Third thing, women tend to have more valgus in the knee. So what is valgus? Your knee is straight like this. This is a neutral alignment. If you bend it outwards like this, it is varus, and if you bend it inwards like this, it's valgus. So women tend to have more valgus in the knee and an adduction torque on the hip. So all these things predispose women to a higher risk of an ACL injury and also a higher risk of ACL injury after surgery. So it is very important to address these issues correctly. So once it is established that an ACL reconstruction surgery is required, then the choice of graft in women as well as the rehabilitation and the techniques slightly vary. At the Shoulder and Knee Clinic, we try to give the best of results to our patient using the latest technologies. So in women athlete, rather than using the hamstrings and further compromising the strength of hamstrings, what we use is a peroneus longus graft. So it is taken from the ankle. It does not compromise the strength of the hamstrings, as well as we get a good, robust and sturdy graft for initial ACL reconstruction, which gives additional stability. In addition to that, in high demand female athletes, we do an additional procedure which is called a LET or a lateral extraarticular tenodesis. So there is a ligament on the outer aspect of your knee joint which controls the rotatory movement of your knee. So women who have a more stronger rotatory movement or a pivot shift, in women, what we do is we tighten this ligament or we reconstruct this ligament by the iliotibial band tenodesis. So that gives initial stability. These are the two things which we do during the surgery, decrease the risk of a re-injury. Now, obviously before surgery, every individual is need to undergo an ACL prehab program so that they have a good recovery after surgery. So studies have shown that individuals who undergo a prehab program have a better outcome compared to those not undergoing prehab for the injury. Third and not the least important thing is, starting 4 months onwards after a rehab program, we put women athletes, all of them, on the ACL re-injury prevention program. So it controls the way you're landing your leg, the way you're jumping, the way you're pivoting and twisting, and your lower extremity as well as your body gets adapted to it so that it is done in the correct way and there is a lesser risk of re-injury. At the Shoulder and Knee Clinic, using these protocols, we have had achieved great results with very less risk of re-injury and good outcomes in our female athletes. So if you like our channel, share and subscribe. Keep watching.